When you're at the doctor's getting a checkup, are you truly able to confidently say, my doctor knows what's best for me and will give me what's right? Or is it possible that you're just another patient in a system that's known to constantly prioritize taking your hard-earned money over actually treating you? Consider this. A study done in 2020 showed that 1 in 5 patients felt shrugged off by their doctors. What does this make you think? Is it possible that we're all just lab rats in one massive medical game? Or are we really being given the best treatment? Listen, we've all been to the doctors before, right? And we've all been sent through the same exact revised process so many times. That same process of appointment, diagnosis, and walking out with a prescription. But when in the cycle do you really go and stop and ask yourself, is this really what's best for me? And is my doctor being fully transparent? We place so much trust in our doctors, and that's truly how we should be. But sometimes this trust blinds us. It blinds us to the ugly truth that sometimes our doctors aren't always telling us the full story. But when you take a look at it from a different perspective, you'll notice that sometimes it's not always the fault of the doctors. In such a corrupt system, where hospitals are just viewed as businesses, what can doctors do when they have such pressure on them, whether it's time or efficiency? Where can they go? I'm sure that if any doctors in the crowd, you might be feeling a bit uneasy. But I want you to know that this isn't just about blaming every medical professional. No. It's about truly understanding the systems and the complexities behind the care that we receive as patients. And as for you doctors, you yourself may not even realize the corrupt system you work under with your colleagues. When you look at the grander scheme of things, you realize again that it's not always the fault of the doctors. Did you know that doctors are pressured to see as many patients as they can in a day? In a system where quantitative results are recognized more than actual patient care, the doctors are usually left in a dilemma between leaving and staying. But when faced with the reality that so many hospitals are just as corrupt, what can they do? The unfortunate reality is that sometimes they can't do anything. Doctors will enter the field with such a passion and ambition for saving lives, but then they'll quickly find themselves caged within a system that just prioritizes efficiency over true care sometimes. But you may be sat here asking yourself, what does this mean for me, right? Let's think about that. You could be the healthiest person you know, but remember, the moment you fall ill, you will re-enter that same cycle of appointment, diagnosis, and prescription, and that same corruption that plagues every hospital. Now, I want you to think at what point this corruption begins to affect you. The pressure doctors receive for efficiency doesn't just affect their attitude towards you in a checkup. No. The medicine you take, the treatments you receive, all of these pass through such a corrupt system where the choice between you and the right treatment is so heavily misconstrued. Additionally, when you think of that life-saving medicine, do you ever begin to question the processes that went behind its officiation? Do you ever wonder what went behind its testing? Well, it's tested by a numerous amount of clinical trials. Now, what are clinical trials exactly? Well, clinical trials are a set of experiments. These experiments are conducted on volunteers in which they test drugs before they're actually released into the public for commercial use, test safety. Now, the thing about these clinical trials is that, yes, while many of them do have consenting volunteers, what about the ones in which they don't? Who gets chosen? Who is allowed to be, who's aware of the full risks of what's being tested on them? And most importantly, are all participants really volunteers, or do they just not have any other choice? What so many people overlook about these clinical trials is the exploitation behind them. So many people will see an excellent drug, but never the evil that went into the process of developing it. For example, in the 1950s, a set of clinical trials were held on so many unstable demographics. Think prisoners, think people in mental institutes. As a result, they weren't told any of the risks of what was being tested on them. And in the end, severe damage and permanent harm was caused. Now, you may be sat here wondering, what is a couple of deaths for eventually a lifetime of people saved, right? Let's think about that. Is it ethical? Do you think the value of human life can be weighed against medical breakthroughs? Are suffering and sacrifice overlookable in the name of progress? In all honesty, there is no true answer. I can't stand here and tell you an answer for a question that plagued the medical profession as a whole for decades. I could tell you that the end never justifies the means, or that it's all worth in the end. But would that truly change how you think? I'm not here to change how you think. When you take into consideration that all of these will never have an answer, you remember why it's so important to keep questioning everything about the medicine that we take. Does this progress come with fairness and transparency? Were the people who made this possible told about the full risks? So that the next time you're at your doctor's and they're writing down that prescription, think about it. Who were the people that made this possible? Were they aware? Keep asking yourselves, question all of these ethics about these trials that we so overlook. Because in the end, every medical breakthrough has an impact. Let it be small, like a cure for a disease affecting a small region of Africa. Or let it be big, like the next penicillin. Just remember that an impact is always there, and it's up to us as a society to question everything about these impacts. Again, does it come with fairness and transparency? And were they told about the full risks? Because progress, especially in medicine, never comes in a flash. It takes years and years of choices and trials, and it's up to us as patients to question these choices, not just doctors and scientists, no, but we as patients have the right to question everything about the medicine that we take. Thank you.